think every nurses also agree with this, that they don't have a time to rest, neither take family. It is quite devastated when you think about that. You know what? You see, when your family is far away from you, the only thing in your mind is make sure they are safe enough, everything. COVID-19 still increasing because of some people, they're not adhering to the SOPs, and you feel like, what's the point of me doing everything?
2nd July 2021. Economic and financial troubles are the focus of an analysis in the Star, as it is more difficult to keep oneself and families afloat in this tough time. Mental issues grow worse as cases of domestic abuse and, sadly, suicide are on the rise. So we want to find out where Malaysians' mental state is currently at. What can we do to help each other before it's too late? With the third lockdown in effect, it is alarming that the seriousness of mental health issues continue to grow to this day. According to a research on MCO's impact on the mental well-being among Malaysians carried out by the Centre, depression, anxiety, and stress are the common factors of poor mental health. These are more common among the young, especially ages 18 to 35, and to people living in zones with high cases of infections. With quarantine and social distancing being necessary to lessen the risk of infection, social isolation is imminent.
Now, let's address the students first, right? Those under the age of 24. You have what I would consider a lost generation, right? A generation affected most by the pandemic. Take yourselves for example, right? You're forced to adapt and learn in conditions which are unprecedented. You're forced to learn through a screen, you're forced to self-learn, to initiate. Your employment chances may not be as good as somebody who's already been in the workforce for the past 5-10 years. If you think about the social aspect of the pandemic, where people live off being social, hanging out with friends, hanging out with being able to go and meet family and friends physically, in a physical setting, it's much different than having Zoom conversations over a screen, over text, or socializing over text or phone. This is what I mean when those under age of 24, people who are primarily still in tertiary education are affected most, because socialization is extremely important to people of this age group. Now they also have to cope with the fact that there is an uncertainty whether or not after graduation, so even after you graduate, we're talking about an economy that you have to adapt to, an economy which doesn't have enough money to hire perhaps new graduates, right? And that is a stressful thing for those ages under 24. So I think that's why we say that those under age 35 experience a lot more negative mental health, they experience worse mental health, because there is so much uncertainty around their social life, there's a lot of uncertainty around their economic and financial life as well, and their employment.
Just imagine you're working 6 days per week, and you have one only day off. The most people will do is sleep at home, gain back all the 6 days tiredness, all the energy that you had thrown during the 6 days. Instead of going on vacation, I don't think so. I think mentally it got affect everybody also lah. Situational wise, working load wise, and then you cannot go here, you cannot go there. You just come to work, go back, stay at home, then come back to work again. One of the reason is because of lack of staff also. It was actually at beginning, it was a nice experience. The energy of helping others, helping the patient with COVID-19, but COVID-19 still increasing because of some people not adhering to the SOPs. And you feel like, what's the point of me doing everything? I do feel sometimes oh, my family is not here. It's very, very sad, everything. But at one moment also, you need to think that even though my family is not here, they are all safe and good in health, everything. I will still call my parents every day, video call, everything. So I know what they are doing. One thing is that, some management, they don't really appreciate you. They give you very less pay. But despite all the workings you are doing, all the overtime, everything you are doing to help them. But the management should have their own brains and think themselves. I think government should do something regarding this, because when you want someone to work, you need to appreciate it and need to pay accordingly lah. No matter it's nurses, doctors or other frontliners. If not, people will say, I'm working so hard, what's the point? I don't get anything. So definitely they will be demotivated with this.
Our healthcare system is on the brink of collapse, right? And it's a sort of situation that is not easy to deal with because one, you do need to meet the needs, the public healthcare needs of society that's going through the pandemic right now. You need healthcare workers basically in order to make sure the entire country doesn't collapse. But the fact that you also heavily rely on healthcare workers is also what's causing them mental health difficulties. It's also causing them burnout. So it's a no-win situation.
Besides the young, mental issues unfortunately do not spare the unemployed either. As a consequence of the pandemic, unemployment rate is high due to factors such as retrenchment and the lockdown laws restricting activities of most non-essential businesses.
Mentally, it's very, I would say, depressing because when you've been working all the while and suddenly you are, jobless, you tend to start to feel a little bit useless. Like, how else can you bring income? How else can you help to pay for, the house expenses and all that? And then it wasn't only me. My entire family is jobless. Like, no one's working. We have really been depending a lot on our savings. There is government initiatives and all that with all the BPR, BPN, but honestly, even with me being retrenched and we are still M40 and we still don't get anything, it's always the middle class who suffers.
Unemployment doesn't just mean you don't have money anymore, but it also means now you lose a sense of identity that is fixed to your job. So when you're unemployed, you no longer have the social means to define yourself by your work. You no longer have, I think, purpose which is attached to work. And then, of course, primarily, you lose your income. Unemployment is a very real condition that can lead towards mental health simply because you lose all safety nets that come with a job. It's also about the fact that you are now also socially cut off from maybe certain safety nets that you used to have if you're working. Like maybe colleagues, for example.
I believe that once you are, not only retrenched, if you are at home, your work tend to revolve around all the housework, and then you start getting angry and irritated with the amount of things you have to do in the house, like cooking, cleaning, laundry. I just wonder how those ladies who are working, they manage all this, because to me, I find it very, very difficult to manage. I guess it also affects the productivity level because you're just going to be at home the whole day. The motivation is not there anymore. Your activities are very limited to just, with your family. Yes, family is good and all that, but there is a reason why everyone goes out. It's not easy to just tolerate your entire family for that long of a period. Actually, honestly, it's draining. How is one feeling with all this lockdown? I guess you feel not only locked down, you feel very locked up. You're just sitting there day to day, repeating the same routine and nothing new.
Now, we have to think about home as a space of where you are personally safe. And the office is a space where it's dedicated for your work, where you get income, where you exercise your professional knowledge. When that space is also used to now be used for work, right? You have what we would say a non-separation. There is no way of physically and mentally separating between what is work and what is personal. This is what we assume then leads to why people who work from home every day suffer or at least experience worse mental health.
I just recently spoke to my friend and she's also very frustrated with her work. Your boss will be calling you until 11, 12 o'clock and she's planning to resign even in this pandemic where it's very hard to get jobs. Everyone is working from home, but that doesn't mean that, just so that you have all the time means you're supposed to spend it on work. Maybe working parents who are at home, like I said, for me, it's very hard to juggle between cleaning and cooking and laundry. Imagine those who have kids. I think it's even worse for them. A lot of them says that you are at home now, you get to spend more time with family. Actually, no. Me and my husband, we are sitting in the same room working, but we don't even get to talk to each other entire day because he's busy with his meetings, I'm busy with my meetings. Either I'm doing my work, he's doing his work. Like, you just have a very short interaction. You get very angry to look at your phone because you will think that there's just so many messages, all work related, or there's just so many requests. It's very draining.
How do we think about housing can also affect people's mental health? How do we think about public infrastructure and architecture and design also affects people's mental health, right? Whether or not, if you're living in an apartment, do you have access to a place where you can jog, for example, right? Do you have access to a place where you can kind of like unwind outside your own home? Low-cost flats don't necessarily have that. So that's what we mean when we think about looking and thinking about mental health, kind of like beyond economic factors. It's also thinking about it from a social factor, thinking about it from a design factor as well. All of this is interlinked when we discuss mental health.
Whenever they go out, everyone have this tendency to constantly look to their phone. I do hope that changes and people start to appreciate the presence of other people around them, because you never know when another pandemic might hit and this will be taken away again.
So let's say we get a vaccine by end of the year, the economy will take about a few years more to recover from the devastation of the past year, right? Which means, do companies have enough time? Companies need time, in fact, to build wealth. They need time to build revenues. They need time to readjust to a post-pandemic world. And in that case, because now you have a low amount of money to go around, to hire people, to get people to work, this is what I mean when employment has long-term effects even after the pandemic, because it's about the economy, and the economy is long-term.
At the time when we're making this video, there are reports of mental health support groups receiving overwhelming responses. According to the center's report, there are only 0.5 psychiatrists available for every 100,000 persons in Malaysia. That's only 200 psychiatrists for every 100,000 Malaysians. Meanwhile, there are only 0.21 clinical psychologists to every 100,000 people. These are below the World Health Organization's recommendation, whereby there should be one psychiatrist available for each citizen.
But if you're talking about, say, how we need more mental health experts, right? For example, you want to increase more clinical psychologists in the Ministry of Health. You need to now talk to clinical psychologists, you need to talk to policymakers, you need to talk to bureaucrats, you need to talk to mental health experts, you need to talk to different segments of the Ministry of Health, different specialists, in order to kind of like craft together what is the perfect act, or what is an adequate enough act to govern clinical psychologists. Then you need to talk about resources. There is a lot of discussion, there's a lot of deliberation, there's a lot of lobbying that goes behind policy making. It's going to take more than a year because of all these negotiations, because of all this lobbying. Politics and policy making is a very, very complicated, long process, because you need to take into account everyone's perspective. You need to see whether or not, if I invest 5 million ringgit in this policy, how will it look like in the next 10 years? And this is where I guess we rely on NGOs, rely on civil society to kind of meet the needs that the government can't meet at that time, but to also continuously push for that discussion to happen.
The war between Malaysians and COVID is far from over. Even with the rapid vaccination drive, deaths and active cases show no clue of stopping. The virus itself remains unpredictable, evident by its evolution into the recent Delta variant. However, these mental health issues have been coexisting for years or even decades. The pandemic or even the lockdown do not cause these issues in Malaysia, but they have shed light on mental well-being. How much longer can we cope before the end? How long must we wait until we are all immune to this biological threat?